On exam, doctors also observed a movement pattern that looked like brief loss of support, a type of involuntary jerk. Psychiatric symptoms plus abnormal movements forced the team to seriously consider encephalitis or autoimmune brain disease as well. So the testing began. Again and again. Brain MRI was normal. A lumbar puncture was also normal. No clear inflammation in the CSF. Infectious testing was negative. Autoimmune encephalitis testing was negative. Extensive blood work didn't reveal much either. Except for one small clue. Her serum creatinine was low. When the tests don't give an answer, doctors often have to treat the most urgent possibilities first. They tried medication aimed at catatonia. She calmed briefly, but soon worsened. The hallucinations and paranoia intensified. She developed a strong urge to flee. Then they did an EEG. She wasn't having a classic seizure, but her brain activity looked unstable, high risk. They started anti-seizure medication. Her EEG improved, but her psychiatric symptoms didn't resolve. The team still worried about missing autoimmune encephalitis, so they tried immunotherapy. She improved for about a day. Then she crashed back again. The misidentification, paranoia, and terror returned. That's when the team stepped back and asked a critical question. If this isn't primary psychiatric illness, and it isn't encephalitis, what are we missing? Because she'd had developmental and learning difficulties since childhood, they shifted to another direction: genetics and metabolism. They ordered targeted metabolic testing and genetic testing. And suddenly the puzzle opened up. A substance called Guanidinoacetate, or GAA, was markedly elevated, while creatine was low. Genetic testing confirmed an autosomal recessive condition, GAMT deficiency, and brain MR spectroscopy, MRS, showed something striking. The brain's normal creatine signal was nearly absent. In other words, her mind didn't suddenly break. Her brain had been missing a critical energy support system for years. The infection acted like a trigger, pushing an already fragile system into full imbalance. And that imbalance exploded outward as symptoms that looked intensely psychiatric: hallucinations, persecutory delusions, misidentifying her parents and believing her home